Hi, I'm Dr. Michael Corey, and thank you so much for watching our Thyroid Recovery Success Secrets. This is secret number 14. We're going to talk about vitamin D today. Now, you always hear in the news that there's some new type of supplement out there. Something to consider, a deficiency to consider. When it comes to Hashimoto's thyroiditis or autoimmune thyroid, it's very important that patients are taking vitamin D to help their immune system. Modern diets are lacking vitamin D in rich foods, and the vitamin D rich foods include liver, organ meats, lard, many forms of seafood, butter, egg yolks. Remember what I used to talk about on previous Success Secrets about eating eggs for breakfast and how important it is for your blood glucose levels. Well, these are the foods that you need to make sure that you're eating on a regular basis. Sunlight is another important factor and source of vitamin D, but you should never take vitamin D without having your vitamin D levels tested, specifically for the 25 OHD and the 125 OHD. Most MDs will only run the 25 OHD, but it's very important to have both levels tested and evaluated. This way you're eliminating any of the guesswork regarding what supplementation you should be taking. Now, different readings, and if you only have one test, it's going to constitute a different recommendation. Now, why is vitamin D so important? Vitamin D, in and of itself, a deficiency of vitamin D is associated with many, many chronic conditions, including Hashimoto's thyroiditis. Frankly, autoimmune rates have skyrocketed in the past 20 years, which correlates with the decreased levels of vitamin D in our society, in the general population. Adequate vitamin D levels will help keep your immune system balanced, and it doesn't swing out of control into an autoimmune condition. So when it comes to Hashimoto's thyroiditis, the problems with vitamin D deficiency is made worse by genetics. Now, there are studies that show that more than 90% of the population of people with autoimmune conditions or Hashimoto's thyroiditis have a genetic defect affecting their ability to process vitamin D. So many people, especially those people needing higher amounts of vitamin D to maintain health, or even in their blood tests show sufficient vitamin D, are still having the deficiency based on the recommendations that the medical doctor is evaluating it from. In many cases, patients will come into my office and the vitamin D levels will be out of range or on the very low side of normal, and your MD says, "You're fine, there's nothing wrong with you, you don't need to supplement." Well, you're fine, there's nothing wrong with you, when actually you're on the low side of normal and you need supplementation of vitamin D to get you back to the upper levels. I recommend that all my patients with any thyroid condition always have extra vitamin D, and I give you the parameters of where we recommend those vitamin D levels should be during our consultation. So don't suffer another day, another minute, another year with your thyroid dysfunction. If you have any questions, call our office. I'll provide you with a consultation on the telephone if you would like so, but we can get more done if you bring in your lab work and we give you a consultation. I do a review of your current blood work and we do an examination with you. We'll get to the root cause of why you're having thyroid dysfunction. My name is Dr. Michael Corey. You can contact my office at 714-730-5833. Thank you so much and have a wonderful day, and I'll see you on the next Success Secret.